Hello and good afternoon to all. Welcome to our webinar series on expanding the scope of research in planetary health in Europe. I am Jaana Halonen. I'm a research program director from Finnish Institute for Health and Welfare, and I'm chairing this session with Jose Maria Anto, research professor at ISGlobal and professor of medicine at Universitat Pompeu Fabra. This initiative is part of the Severo Ochoa strategic program of ISGlobal and the result of strong collaboration between ISGlobal, THL, and the London School of Medicine, London School of Hygiene and Tropical Medicine, Center on Climate Change and Planetary Health, from where the responsible colleague with us has been Alan Dangur, who is professor in food and nutrition for global health. Idea for this webinar series is rooted in the conference Europe That Protects, Safeguarding Our Planet, Safeguarding Our Health. And this was held in Helsinki in 2019 under the auspices of Finland's presidency of the EU. There, researchers, policymakers, and regulators presented and discussed issues related to planetary health. Today, we start this webinar series by giving an overview on the planetary health concept and the contribution and role of science in it. The three upcoming sessions will cover different, more focused topics that fall under the planetary health concept. And these are food systems, sustainability and health, which will be next week, energy, decarbonization, health and equity in about 2 weeks, promoting health through sustainable urban development, which will be week after that. And the final session will look into the future and needed steps forward on 24th of March. But let's get going with today's program, and I give now the floor for Josep, who will present today's guests.
Well, thank you very much, Anna. It's a big pleasure to welcome all you to this first session, Strengthening Planetary Health Research and Action in Europe, that, as you see, takes the title of the entire program. Well, as you can imagine, this program was conceived before the COVID-19 pandemic, something that has transformed our societies and our lives in an unprecedented way. And with all the terrible and devastating impacts, one important lesson take with us. And the lesson is that the solutions to both the pandemic and to the climate crisis are available, and these solutions must be based on the redefinition of prosperity to achieve a better health and well-being for all with capital letters, together with the full respect for the integrity of the natural systems. In this first session, can you put the next slide, please? We will focus on planetary health as an approach to align the unfinished agenda of the global health with the 2030 SDGs agenda and the increasing urgency to respond to the climate crisis and the one of the other natural systems. And for this, we are very fortunate to have an exceptional panel of speakers. Professor Howard Franklin will address the role of science for achieving sustainable development and how planetary health fits into the big picture. Professor Johan Rockström will talk us about the planetary boundaries and the urgency of translating science into impactful policies. Professor Sirandi Haynes will review the development of planetary health as an evolving multidisciplinary research framework. Professor Joyita Gupta will summarize the recent United Nations Global Environmental Outlook, which has highlighted the notion of healthy planet and healthy people. And Mrs. Marian van Mierlo will update us on the Horizon Europe landscape in this very unique context of the Green Deal and the COVID recovery strategies in Europe. Finally, Jana and I will bring some of the questions of our audience to the speakers and finalize the session with few concluding remarks. For the sake of the logistics of the session, remember that the webinar is being recorded, that for technical reasons, microphones are deactivated, and that the chat is also deactivated, and the raised hands module will not be attended. But very importantly, please submit all your questions through the question and answers button, and Christina O'Callaghan, also from the organizing committee, will help us to screen all the questions. Please don't forget to indicate to whom your questions are addressed. Just with this, let me say final words to acknowledge the great work of Ariana Moreno to manage the full program. The program, also the help of the Mari Carmen, Aleix, and other ISGlobal people, and very especially the fantastic collaboration we have had and we are having together between ISGlobal, the THL, and the London School in London. Thank you very much. Without no further delay, Professor Howie Franklin, Howie, the floor is yours.
Thank you very much, Joseph. Can my now? Let me confirm.
Perfect.
Thank you very much. It's an honor to be here. It's a real honor to share the podium with my most admired thought leaders, and it's very nice to see old friends from my time both in Barcelona and in London. And a good day to everybody from Seattle, where it is 6 in the morning. By way of introduction, I have had the good fortune to work at the intersection of environment and health for several decades now at the U.S. Centers for Disease Control and Prevention at the University of Washington and at the Wellcome Trust. I love synthesizing and writing. These are a few of the books that I've published, including this Planetary Health book, which Andy Haynes and I will publish this coming year. So it's based on this background that I take on the task today of providing some big picture perspectives on planetary health research, some background and context, hopefully to set the stage for the remainder of the webinar series. Well, to begin with the big picture, and nobody needs reminding that we live on a different planet than the one our grandparents inhabited. We have changed the chemistry of the atmosphere and of the ocean. Biodiversity is well diminished from what it was in pre-industrial times. We have begun to deplete soil and water. We've changed land use globally. We've changed biogeochemical cycles. We have loaded the environment with dangerous chemicals, and we've loaded the atmosphere with aerosols. So here you might say we have 12 horsemen of the apocalypse. It is a different planet than the one our grandparents inhabited. There's a bit of good news.
Excuse
the ozone
me,
depletion seems to...
Howard, I'm sorry.
No.
Have you changed the slides? We are seeing the first slide.
You are seeing the first slide. Well, that is a problem. Let's see. What do you see now, Jana?
I can see the first slide
Still the
still.
first slide. Well, we are having a technical problem then. Let me stop screen sharing and start again and see if that solves our problem.
Because it seems like you have not expanded the slide. You have not put the slide in the large.
Okay.
This may be enough.
Well, Yeah, let's see.
Maybe try starting in the presentation mode.
That's what I did, but let me try again. Let's see. And I'm sorry that I can't see from my screen what you are seeing, so I need to be asking you for feedback.
Yes, we still see your
You
first
still see
slide
just the first slide.
in the small picture together with the other one. So you need to enlarge, just to press the button for the large screen. I mean, to put the first
Yeah.
slide here. Yes, I think so.
Did that do it?
No, it doesn't work. Yeah,
No.
no. So probably you need to
Yeah.
perhaps in the meanwhile, I suggest Ariana.
I can share the screen for you, Howard.
Ariana can share the screen
Thank
for
you.
you.
Let's do that. So if you'll turn off my screen sharing from where you are.
Howard, can you stop sharing your screen so I can share mine? Thank you.
Yeah.
Sorry, everybody, for the small inconvenience. I'm sure that we will have a great session, but it's...
We can assure you all that on the technical check beforehand, everything worked perfectly. Okay, so next slide, please. I already introduced myself. Next slide, please. And I've already surveyed or inventoried the ways in which the planet has changed since our grandparents' time, a series of biogeochemical changes that challenge us. But these are not the only changes we need to contend with in considering the big picture of planetary health research. Next, please. We have a series of social and demographic changes as well, population growth, an aging population, and a concentration of the human population into cities around the world. Next, please. We also confront inequities such as poverty and income inequality, racism and discrimination, which greatly complicate the human condition. Next, please. We contend with disinformation in a rapidly changing information environment, and partly as a result of all of these things, the rise of populism and autocratic leaders around the world. Next, please. And we contend with pandemic illness, the COVID pandemic, as well as the rise of non-communicable diseases, which continues, and the decline of social capital and the rise of loneliness. So not only 12 horsemen of the apocalypse, but 24 horsemen of the apocalypse. Next, please. These problems, of course, are not unrelated. They are interactive with each other, as exemplified by this picture of a COVID warning sign at a center for elderly people that was burning in the wildfires in California this past year. Next slide, please. In fact, we live in what has been called a polycrisis, with COVID-19 apparently being eclipsed by the great economic recession that will soon occur, is already occurring, and that in turn being eclipsed by the problem of, excuse me, by climate change and other planetary changes. Next, please. In fact, the best way to think about these problems is this: they are all interrelated with each other. So we need to be systems thinkers. We contend with very complex global problems. But before turning to planetary health research, I need to mention two additional parts of the challenge landscape we face. One is cognition and one is velocity. Next, please. If we were well equipped to handle these problems, we would be a species that makes decisions based on rational analysis, not based on heuristics, biases, and tribal affiliation. We would be a species that thinks long-term, not short-term. We would be a species that thinks in terms of complexity, not simplicity. But unfortunately, 2 million years of evolution did not make us that species. And so we confront our own cognitive limitations in the face of complexity as well. The other contextual issue is velocity. Next, please. The changes that we face are accelerating. On the left here, you see a picture of the extinction of species since 1500, and you can see that the rate is rapidly accelerating. On the right is a picture of insect population declines, also moving very, very fast. Next, please. Here is a picture of Antarctic sea ice, and as you can see, the loss is rapidly accelerating. Next, please. Here is a picture of glacier loss. Again, rapidly accelerating, this recurring theme of rapid acceleration. Next, please. And here is a picture of global weather-related catastrophes. And as you can see, the same pattern, rapid acceleration. Next, please. All of these are bringing us closer and closer to tipping points, which I think Johan will be talking about in just a minute, the possibility of irreversible and catastrophic changes in Earth systems. Next, please. And a final note on velocity. This is a picture of various pathways to limit global warming to 1.5 degrees. The different pathways distinguished by different development scenarios and different climate responses to emissions. Next, please. Every one of these scenarios to get to 1.5 degrees involves dramatic CO2 emissions reductions starting now. Next, please. But rather than starting those emissions reductions in a dramatic form, we are continuing to increase our emissions. So again, the velocity is a challenge because we need to be acting now in contradistinction to what we're actually doing. What does all of this mean? Next, please. It means, by anybody's definition, an emergency. Next, please. And so planetary health research confronts the need for urgent transformative solutions to help do no less than rescue the planet. Well, in that context, I'd like to offer 6 propositions regarding planetary health research. Next, please. First, the research should be consequential. It should matter. Next, please. On the concept of consequential research, I want to borrow from Professor Sandro Galea, who has written about consequentialist epidemiology. I have written about consequential environmental epidemiology. The concept here is that we should be focusing research on issues of public health and environmental importance, rather than on issues that are arcane, issues that affect small numbers of people and/or that have very little impact on the environment. We need to study the things that matter. Next, please. Second proposition is that the research ought to be solutions-oriented. We have a number of problems to solve, and we need to be about finding solutions. Now, the good news is that finding solutions becomes a virtuous cycle. Next, please. Here, for example, are sets of solutions as part of the green economy: clean energy, well-designed cities, sustainable diets, and green chemistry. It would be great if we could determine that these solutions also improve and protect human health. Next, please. That is, if these solutions could address the major health problems that challenge us as a society: heart disease, lung disease, cancer, and so on. Next, please. The good news is that clean energy delivers each of the health benefits shown here, and each of those blue arrows reflects a solid body of evidence. Next, please. Well-designed cities deliver many of the same benefits. Next, please. Sustainable healthy diets, as Alan and colleagues will show next week, deliver many of the same benefits. Next, please. And green chemistry, changes in our manufacturing techniques, deliver many of these benefits. So the search for solutions is highly productive, both for the planet and for people. Next, please. Third proposition, our planetary health research should embrace complexity. Here is an example of why that is. Next, please. The nutritional world is, among other topics, very interested in nut consumption. Nuts are good for health. Next, please. There's a robust literature showing that various kinds of nuts, almonds, walnuts, cashews, pecans, are good for cardiovascular health, good for all-cause mortality reduction, and so on. But there is a problem. We can't just think about this as a nutritional issue. Next, please. This picture shows the water footprint of various foods. Nuts are over on the right in red, and you can see that nuts have a higher water demand than any other food except for cow meat. Well, what does that mean in terms of impact on the environment? Next, please. In my country, in the US, California is the source of almost all of these nuts: almonds, walnuts, pistachios, and a number of other nut species as well. California, in turn, comprises a large proportion of the world's supply of nuts. Next, please. But what do we know about California's capacity to grow these nuts or to increase its production? Well, California has for the last decade suffered an unprecedented drought. Next, please. And we know that the future projections include more severe droughts, more erratic and chaotic rainfall patterns, and less water from snowmelt. Next, please. So here we have a health challenge and an environmental challenge colliding with each other, underlining the need for us to be systems thinkers and to ask complex questions in order to get the right answers going forward. Next, please. Fourth proposition, we should focus on the most vulnerable in our planetary health research. Next, please. This is a picture of overall direct risks of climate change comprising just 3 risks: extreme weather, sea level rise, and agricultural losses. And you can see that the darker red colors, the countries of the global south, are the countries that face the highest risk. Next, please. And this is not only a practical problem, but a moral problem. The map on the top, which is probably familiar to many of us, shows countries sized according to cumulative carbon dioxide emissions until the year 2000. The map on the bottom shows countries sized in terms of their vulnerability to climate change. And you can see that there is a disconnect. The high emitting countries are not the vulnerable countries. So we need very much to focus on the countries that have done little or nothing to contribute to the problem, but are suffering disproportionately. Next, please. My 5th proposition is that scientists and health professionals should be advocates. Now, this is controversial. Many of our colleagues think that our role is simply to produce data and throw it over the transom so that policymakers and the public can utilize the data. My contention is that we have more of a responsibility than that. We should be advocates. Next, please. One reason for that is that we are highly trusted professions. Scientists, followed by doctors, are the most trusted professions globally. That means that our voices have dramatic impact, and we should learn to use those voices. Next, please. Now, many of us communicate by emphasizing complexity and uncertainty. This is standard scientific discourse. Next, please. If we believe that we need to be advocates, then we need to learn to advocate well. That means simple, clear messages repeated often from a variety of trusted sources. This is the basics of social marketing. And we need to learn and use that. Next, please. There are many ways in which we can do that. Next, we can write articles for newsletters, newspapers, and magazines. Next, we can provide expert testimony to governments. Next, we can provide public speeches. Next, we can even engage in direct demonstrations and actions, all of them valuable ways to use our voices. Next. And finally, I propose that we should propel hope. The data that we regularly confront, the kinds of data that I referred to earlier, can be very grim. Next. Grim data can trigger depression and anxiety. This is probably how you all feel given everything that I've said so far. Next. But despair and depression accomplish nothing. We need to propel hope. And indeed, there is ample reason to have hope. Technological advances, governments that are moving forward, popular will that is increasingly mobilized in favor of what we need to do. Next. It's no exaggeration to say that this is a picture of the mission ahead of us. We have no less a challenge than to rescue the planet and to rescue civilization as we know it. Planetary health research is an important part of meeting that challenge. Next. So to summarize, I've proposed 6 aspects of planetary health research that I think should guide us moving forward. It should be consequential and solutions-oriented. It should embrace complexity and focus on the most vulnerable. We as scientists and health professionals should be advocates, and we should propel hope in every opportunity. Next, thank you very much for your attention. My apologies for the technical difficulties, and I look forward to the rest of the session today.
Many thanks, Howard. That was excellent. And you managed to still keep the time, so thank you also for that. Now we can move on to Johan Rockström, please. You can start your presentation.
Yes, thanks, Jana. Thanks, Howard and Joseph, and great to see you at this session. Let me see if I can then share my screen. So I'm trying to do that, and we can see if technology will be helpful this time then. Let me see.
Now we can
here.
see it.
Yeah, but you cannot see it in presentation mode, can you?
No.
No, exactly. For some reason, I'm not able to. Let me see if I can. There's a little. Okay, there we
Here
are.
we go.
That should do it. Excellent. Okay.
Yes.
So I'll be building very much on Howard's presentation to give you a kind of a scientific framing of what I see as the new frontier in planetary health science. And all the empirical curves that Howard presented on the accelerated journey towards dangerous state of our Earth system has led, as I'm sure you're all aware, to what I would call the most important scientific message over this last decade, namely the conclusion that all of this empirical evidence of the accelerated pressures on the Earth system leads to the conclusion that we've entered a whole new geological epoch, the Anthropocene. We are now, we humans, anthros, the largest drivers of change on planet Earth. We're such a large driver, in fact, that the scientific community for the first time is forced to address the following question. Are we at risk of destabilizing the entire planet and thereby undermining the possibility for future generations to provide minimum level of livelihoods for a growing world population? As Howard pointed out, the speed and the scale of change is today unprecedented. And as Howie also emphasized, COVID-19 is but merely a manifestation, an even expected manifestation, an even projected manifestation of the Anthropocene. We have therefore so much data and unequivocal evidence today that we're facing not only an emergency, as Howard pointed out, on climate, but also in terms of ecosystem crisis and in terms of a health crisis. And not only that, we have rising empirical evidence that these three interact together, and that, for example, COVID-19 as a zoonosis, where we have so much empirical evidence that over the last 20 years, we have another hockey stick in terms of rising zoonotic viral spillovers from wildlife, often over intermediate hosts to humans, an impact and effect of the Anthropocene in the interconnected world of the 21st century. This is the driving forces expect. We also have rising evidence that this is related to the environmental crisis and the climate crisis that we're seeing. In a recent intergovernmental panel of the Biodiversity and Ecosystem Service, the IPBS work, coming to one more piece of evidence showing that unsustainable and risky exploitation of ecosystems, primarily expansion of food systems, increases the risk of viral spillovers such as the zoonotic viral crisis of COVID-19, combined with trade and markets of wild animals in a transport globalization in the world we see today, can explain how we move from viral spillover to epidemic to pandemic in such a rapid pace. In fact, 70% of the emerging diseases in the world are zoonotic viral spillovers, and 100% of the pandemics are zoonotic diseases. So if we want to really build resilience in a post-COVID world, we need to invest in sustainability of ecosystems and climate. So that is one of the key conclusions when now trying to navigate the next steps in our evolution on Earth. Now, what we're seeing today, just as Howie pointed out, is impacts starting to be really severe already at 1.2 degrees Celsius warming and the extinction levels that we've reached today. We have since 1970 lost roughly 70% of populations of mammals and birds and reptiles and fish populations. So basically in the lifetime of many of us in this room, certainly in my lifetime, we have entered the 6th mass extinction of species. We're also today able to conclude, unfortunately, that 2020 is among the 5 warmest years on record, the previous 5 being the most recent 5 years. We also have so much evidence of the attribution of everything from storms, heat waves, disease patterns, and accelerated impacts of extreme events such as flooding and Earth-related disasters that are all today attributed to changes already at 1.2 degrees Celsius warming. This document summarizes this in a very eloquent way. The United in Science report from 2020, I would like to point to that because it just shows that apart from all the sources of research groups and Earth observations, it is also today summarized in very well communicated ways from science in this report from the IPCC, the World Meteorological Organization, and the Global Carbon Project, meaning Future Earth. Now, this is increasingly understood, which I also think is what Howe is trying to communicate here, that we're talking about integrated science, which also has consequential high relevance for society at large. The annual global risk report of the World Economic Forum, which I'm sure you're all well aware of, is again emphasizing that the highest impact on the y-axis and the highest probability on the x-axis of crisis impacting business up in this right-hand corner of the global risk report are again having, of course, infectious disease outbreaks, but also climate crisis and biodiversity crisis and extreme events related to climate and biodiversity loss at the highest risk assessment. So we are in a world where both science and business are concluding that we are facing not only unprecedented, but in many cases unacceptable levels of risk. Now, that is the situation today. But I'd like to, in terms of setting the stage for the new science on planetary health, focus on this little blue marble and its future. This is the classic photograph from Apollo 8, as we all know. And what it really communicates is where the science is standing today, that we are today in the depth of the Anthropocene coming so close to tipping points and nonlinear irreversible changes. In short, we are hitting the ceiling of the capacity of the Earth system to remain stable, that now is the time to become stewards of the entire planet for humanity's future. Just to give you a few latest updates on the insights from this stability of the Earth system. So this is what I would argue to be potentially the candidate, the most important scientific figure of the last year. This is the first time a climate model is able to reproduce the cycling between deep ice ages and warm interglacials of the Earth system over the past 3 million years. So on the x-axis here, you have 3 million years, the entire Quaternary geological period. It includes the Pleistocene and the most recent Holocene. The Holocene being the period we left when we left the last ice age 20,000 years ago, and the last 12,000 years of interglacial. On the y-axis, you have the global mean temperature on Earth. The 0 point here is the pre-industrial average temperature on Earth, meaning roughly 14 to 15 degrees Celsius. The green line is the model reproduction of this cycling up and down, which of course is related to natural pressures on the Earth system from orbital forcing, volcanic eruptions, and earthquakes. Black is the validation lines from ice core and proxy data from tree rings, etc. Now, the remarkable, I would even call it almost like philosophically or spiritually humbling conclusion here can be seen just if you look carefully at what this is telling us, namely, not at one time during this entire 3 million year period has the average temperature on Earth even approached, but much less exceeded 2 degrees Celsius. We've never been close to the 2 degrees Celsius point that has been such a focus in all our climate policy. The planet has stayed within a very narrow corridor. Maximum warmth, 2 degrees Celsius, deep ice age, -4 to 5 degrees Celsius. And now we are following a pathway that if we continue burning fossil fuels as today and destroying nature as today, would take us well beyond 3.5 degrees Celsius warming just over the next 80 years, a point we haven't seen for the past 10 million years. We also know that the corridor is even more narrow over the last 12,000 years because that's a ±1 degree Celsius world. But the key insight here, what really is such a deep message from science, is not only that we've never passed 2 degrees, it's also that we know why the Earth system has been staying, or the planet, so narrowly in this corridor. And that has to do with the resilience of the biophysical systems on Earth. This is proven in this graph from the Global Carbon Project. Here you have on the x-axis from the Industrial Revolution 1850 up until today. And on the y-axis is emissions of carbon dioxide in gigatons or billion tons of carbon. Above the zero line, you have the hockey stick of burning of fossil fuel in gray and land use change or emissions from deforestation in orange, the rising pressure of rising emissions. Is it all of this area under the curve that has created or caused the 1.2 degrees Celsius warming so far? No, we know that shown below the zero line, that nature has been our best friend so far and actually continues to be our best friend by taking up carbon dioxide in oceans in dark green and on land in our natural ecosystems on land in light green. And the most remarkable is, as you see, the more pressure we pose on the Earth system, the more nature has been helping us by absorbing more and more carbon dioxide. And it's only the blue residual part that it caused the 1.2 degrees Celsius warming so far, where we've reached now the warmest temperature on Earth since the last ice age. This just shows us that it's the resilience of the Earth system that has been able to buffer and dampen pressures to keep the planet in the narrow corridor so far. So that is one key reason why we have to become stewards for planetary health. Unfortunately, we have more and more scientific papers like this one showing that we're seeing cracks in the system. Forest fires, disease outbreaks, droughts are causing carbon sinks on terrestrial ecosystems to start showing signs of decline. This is a deep worry in terms of science. How we showed this graph already, which gives us an additional insight on the challenges we're facing. This is our attempt for the first time, which was summarized just before the pandemic broke out, to summarize the state of the tipping elements that we know support the state of the Earth system. These are the 9 big systems on Earth that are showing signs of approaching tipping points, meaning that they are on the move and showing tendencies of slowdown or changes in their functioning. But the most important is the connection between the tipping element systems here. We have more and more evidence to show that what happens up in the Arctic and on Greenland in terms of accelerated ice melt connects with the ocean heat overturning system in the North Atlantic, which in turn impacts rainfall over the Amazon, which in turn, of course, is related to forest fires and droughts. So here we have interconnections between systems that regulates the state of the planet. So that is why we conclude we need planetary boundaries. We need to today have science-based targets that can give us a safe operating space for us to navigate a stable future in this situation of being so deep in the Anthropocene. We're today transgressing 4 of the 9 boundaries, and that is one of the challenges that we need to bring with us in the planetary health agenda. So that is why it's so timely to have the Planetary Health Commission report that Andy Haynes has been leading, the Eat Lancet report that was also an attempt to apply the planetary boundary framework on the food system. So these are all aligning in this integrated science that Howie pointed out. We have so much entering this agenda. Here's just one example of how freshwater systems are so intimately connected with the stability of the Earth system and impacting on people. The red parts here are regions that we today conclude that they to 80% or more generate their rainfall from evapotranspiration from functioning natural ecosystems, which means that what happens upwind is impacting the livelihoods of regions downwind, as an example of how interconnected we are in this Earth system. We also have the assessment of how heat waves are impacting on the stability of economies. Here is Howie's map of fragility shown in colors, but in black dots you have the regions that today have an average mean temperature exceeding 29 degrees Celsius. The black dots here, meaning areas that are impacting on health and mortality. If we continue burning fossil fuels today, these regions will expand to the hatched areas. And look at the geographic expanse here. These are areas in Brazil and West Africa and Middle East and Southeast Asia and India that would in just 50 years' time, under business as usual, essentially be threatening the livability for humans because just of the heat impacts, causing potential geopolitical instabilities in large parts of the world. A planetary health threat just from the trajectories we're moving. This is the pathway that Howie showed we need to follow to a safe landing zone for climate. That includes not only the pathway to decarbonize energy, it also requires shifting over the food system to become a carbon sink. It requires taking care of the green and blue carbon sinks in nature. So it's just a reminder that we're talking of a global sustainability transition in order to even land safely for the Paris Climate Agreement. It requires applications of a planetary boundary framework in the food system. So the Lancet Commission report was an attempt to define, from the food system related planetary boundary transgressions. And we know today that this is one of the primary sectors in terms of addressing not only climate, but also biodiversity, land, fresh water, and interference with nutrient cycling. So again, showing the integrated systems perspectives we need for the food system. I'll just go to the final closure here to say that we're starting to see more and more countries and regions applying this kind of framework. For example, in New Zealand, in Germany, the European Union and the European Environmental Agency. So it is science being applied in the real world. This is the latest applications for New Zealand, trying to take the science from the planetary boundaries to the entire economy of both agriculture and development in different sectors in the country, and how we can scale this now from countries to regional levels in different parts of the world. So it's quite an exciting area. And I just want to close by, because Joyita Gupta is here as well, we co-chair together with Qin Dahe from China, the Earth Commission, which is an attempt of taking the science to define scientifically a safe and just corridor for humanity's future on Earth. So we see the planetary health applications are now being advanced also in the scientific community, which can guide us in this adventure of the fourth industrial revolution that needs to be capped within the safe operating space of a stable planet. And that's perhaps our biggest challenge of how we can get innovations to move in a transformative way, but be capped within safe targets for the Earth system as a whole. So the Sustainable Development Goals need to be placed within the safe operating space. And I think that is a new definition of sustainable development to guide us in the future for planetary health. Thank you, and back to you, Joseph.
Thank you so much, Johan. Fantastic presentation. And we now give the floor to our next speaker, Professor Sir Andy Haynes. And Professor Andy Haynes will review the development of planetary health and its evolving framework, which is multidisciplinary in essence. So Andy, the floor is yours.
Thank you, Josep. Can I check, first of all, you can see my slides?
Sure. Yeah.
Good.
We can see. Great. Perfect.
Excellent. Well, thank you very much. And it's great to be with many old friends and to hear the two great preceding presentations. What I want to do really is briefly to outline the importance of the development of planetary health as a transdisciplinary research framework. And I've actually changed the original title, which was multidisciplinary. I'm using the word transdisciplinary, and I'll explain why in just a moment. Johan and Howie have very eloquently, I think, outlined many of the challenges confronting humanity. And this slide really attempts to summarize how human health might be impacted on by those driving forces and the effects of the changes in the global environment that are causing such widespread disruption to natural systems. You can see that the planetary boundaries then and the driving forces affecting those planetary boundaries are affecting today and increasingly in the future the risks of a whole range of different health outcomes, the non-communicable diseases, heart disease and stroke through air pollution, through diet, for example, infectious diseases, as Johan has already outlined, emerging zoonotic diseases, malnutrition in all its forms, both undernutrition affecting at least 700 million people, probably more, and overweight and obesity, and of course mental health. And we're realizing that mental health is a pervasive impact of environmental change on mental health in terms of the disruption caused by climate and other changes, affecting people's mental health in a range of different ways. It's also led, for example, to the use of new terms like solastalgia, which is the grief caused by environmental change that communities are experiencing, evolving before their very eyes. So although there's a lot we don't understand, I think we can, with confidence, we can say that the planetary boundaries and the forces, the drivers pressing up against those planetary boundaries are having very pervasive effects on human health. These will get greater in future. They will be probably non-linearities, and we will enter into a period of increasing unpredictability and uncertainty, but with very severe implications for human health. But I think we need to move beyond documentation of the threats and dangers to health, but partly I think for the reason that Howie enunciated, the need to convey health and to create a positive vision of a planet and a society and an economy in which we all want to live. So in the Planetary Health Commission, we identified 3 broad challenges that had to be addressed in order to safeguard planetary health, which we defined, as you know, both integrating human health and the state of natural systems. The first of these was the imagination or conceptual challenges. And one example of that would be the fact that we tend to prioritize increase in economic growth, in gross domestic product, as the kind of key policy priority in many of our political lives of our societies. But GDP, of course, is a very poor reflection of health, and it doesn't take into account the fact that we're eroding these underpinning natural systems on which our whole economic development and health depends. So unless we reconceptualize what the world economy is supposed to be doing and reconceptualize it as placing health and well-being at the center of the economy, very much bounded by the environmental limits to human progress, then we will not make the progress that we actually need to see. The second topic, of course, is knowledge. Knowledge generated by research, but knowledge is not generated in a vacuum. Knowledge needs to be contextually appropriate, it needs to be methodologically rigorous, it needs to embody a whole range of different disciplinary perspectives if it's to tackle these complex systems, the interrelated problems that we've already heard about. So currently, our research endeavor often fails to generate appropriate knowledge, partly because we don't work in a transdisciplinary way, partly because we don't involve decision makers and those people who have to use the outputs of research in the design and the prioritization of research. And finally, a great challenge is the implementation challenge that Johan also touched on. But sometimes we do know what to do, but we often don't do it. And the reasons for that are complex, but they include major behavioral barriers to change, also major political barriers, ideological in some cases, and also, of course, powerful vested interests that are sometimes spreading disinformation about the policy options and undermining what should be a scientific and political consensus about the way forward. So there's much to be accomplished in these 3 broad areas. So what are the challenges for research and action? Well, firstly, of course, we've heard from Howie and Johan about the complex systems. The important thing about complex systems is they often lead to non-linearities, to unexpected outcomes. So there's difficult sometimes in quantifying the outcomes because the effects are not necessarily linear. They also lead to important trade-offs and unintended adverse consequences of potential solutions that need to be taken into account when designing and implementing potential solutions. Many of the effects are delayed. So, for example, if we are to wait until the signal the devastating effect of human health of environmental change becomes unequivocal and overwhelming, that will be too late. By that point, it'll be impossible to rectify the situation, which is why it's so important, of course, to act now. Intersectoral action is crucial, but of course, many sectors exist in policy silos. So in governments, for example, we have different ministries, many ministries, the Ministry of Finance, the Ministry of Energy, the Ministry of Transport, the Ministry of Health. They're all vital for planetary health, and yet they all operate in a kind of vacuum. And there are very few governments in which there are cross-governmental mechanisms for implementing change at the scale and pace that we need in order to address the challenges of the Anthropocene. And finally, a whole organization of our research is very poorly set up to foster transdisciplinary knowledge. Certainly in the UK, and I think with many other countries too, our research is set up along disciplinary lines in terms of specific topics, the natural environment, engineering, health, medicine, the economic and social sciences, and so on. And what we actually need, of course, is to create much more cross-cutting research mechanisms that will allow us to drive forward this research agenda, this transdisciplinary research agenda. We need to also work with policymakers. Very few policymakers have any grounding at all in science. Very few politicians do as well. So there's an urgent need to increase the kind of receptive ability and receptive capacity of policymakers. And we scientists, as Howie has told us, have a real imperative. There's an imperative on us to communicate these messages in a simple way, but without obscuring some of the difficult choices ahead. So how can science and research help to accelerate progress towards the transformative change that we've heard is necessary? Well, we can help to identify the key tipping points, not just for environmental changes that Johan has described, but also for rapid social change. How can we catalyze behavior change on a mass scale rapidly over a few decades? We need to emphasize the opportunities and benefits of change, the multiple benefits of policies. Clean energy, we've heard already, can help decarbonize, reduce ocean acidification because of reduced CO2, but can also reduce the burden of air pollution, for example. And we believe about 3.6 million premature deaths a year are due to the effects of air pollution, ambient air pollution, caused by the burning of fossil fuels. So if we could take out those fossil fuel sources, then we would prevent climate change, much climate change, but also benefit health in the near term. And finally, we can help to catalyze the uptake of policies, technologies, and interventions by delivering evidence in an appropriate way. And also, I think, directing our attentions more to the evaluation of the effects of policies, technologies, and interventions. We need to move beyond observational science. So why do I use the term transdisciplinary? And I think this is a useful summary of the difference between different disciplinary perspectives. So we have the monodisciplinarity at the bottom that many of us were brought up with. We have our narrow disciplines. We work the whole of our professional lives in those narrow disciplines. That may have worked to some extent in the Holocene, but it certainly won't work in the Anthropocene. Multidisciplinary perspectives imply a kind of additive effect of just adding different disciplines together. Interdisciplinarity implies an interactive effect, but transdisciplinarity implies a much higher level of collaboration and synthesis. And that means that different scientific disciplines need to take the trouble to learn each other's languages. I don't mean that, whether it's speaking in French, German, or English, but more the disciplinary languages. And also, we all need to be humble about the contribution of our own disciplinary perspective to this overall endeavor. So there's a great deal we can all learn from interacting right from the inception of our research with different disciplines in an equal and receptive way. This slide just summarizes many of the complex exposure pathways between climate change, in this case, health exposures. It shows you some of the modulating factors, demographic, socioeconomic, other environmental factors as well that influence the magnitude and pattern of risks. So you can very rapidly see that in order to understand these, we need to look holistically, not just at climate and other environmental changes occurring in isolation, but how they interact and how they interact with various social and demographic changes as well. And these exposure pathways at the bottom range from the very direct, like heat stress that we've already heard about, affecting labor productivity, increased heat-related mortality, increased premature births, and so on, extreme weather events and disasters, and those pathways that operate through natural systems, for example, affecting food supply and safety, or the emergence of zoonotic diseases, for example. And then on the right side, those pathways that are mediated through socioeconomic systems, so increasing poverty, probably increasing conflict, population migration, population displacement. And so you can see that it's essential really to look across these range of pathways using appropriate methods across this range of pathways, but also to explore the interaction between climate and other environmental changes. In order to do that, we need to map out the current research endeavor, and this is a recent paper that's been submitted, led by our colleague Leah Brang-Ford, involving Alan Dangour and myself and others, which is a topic map of climate change and health research, papers published since 2013, between 2013 and 2020. And what it does is it maps out the words, it's a kind of word map, if you like, of the different topics. And what you can see is that there's about some 8,500 papers on the impacts of climate change picked up by this search. Only a minority of those are solution focused on adaptation, about 7%, and about 10% on mitigation. A lot of the mitigation papers are focusing on the air pollution co-benefits of decarbonisation, which are, of course, very important, but they're not the only element of mitigation and co-benefits research that we need to be doing. So processes and methods like this can help to rapidly map the complex landscape of environmental planetary health research and help to show us where the gaps are. But we also need to drill within this literature. If we look within the impacts literature, for example, a lot of these studies will be short-term studies of single events. They don't necessarily tell you what the trends are, nor do they tell you to what extent we can attribute different changes in human health to changes in the environment. We also know that many of the studies on adaptation and mitigation are modeling studies. They don't actually tell us what's happening on the ground when people try to implement some of these changes. Detection and attribution is a really important issue. So that's really an attempt to find a signal emerging from the noise, try to determine the cause of any detected trend. This is being much more widely now used in climate change research, but has been to a very limited extent used in human health research. And we increasingly need to work with our colleagues in climate and other environmental sciences to include some of these detection and attribution techniques in looking at the effects of environmental change on human health, including the interaction between different environmental change. There's already some indication that human health is being affected, but we don't know the full magnitude of that. This slide just shows us some of the complex pathways by which nutrition can be impacted on by a range of different pressures, fresh water use, greenhouse gas emissions, land use change, etc. And some of and Johan and Howie have alluded to some of this. But what it does, I think, this kind of exercise is it exposes the pathways that could affect food and nutrition in an interactive and sometimes a synergistic and multiplicative way. And we'll be hearing more about that in the subsequent seminar in this series. But what it shows us is that the food system is under pressure, not just from climate, but also from pollinator loss, from increased pests. There's reduced food plant diversity. There's downward pressures on labor productivity, so extreme heat, and on the productivity of livestock as well. And of course, we know also depletion of fresh water. We've heard that in California. It's also happening in parts of the world like India, Northwest India, for example, where we and our colleagues are studying the nutritional challenges. So we need to link human health and environmental health indicators much more effectively. We've been arguing for a planetary health watch system, which would encompass discovery, surveillance, and decision support, decision making. It would link much more effectively than we've done in the past Earth systems data with human health data, would involve using increasing computational power, open APIs, and so on, using data to drive action, transparency, accountability, using data links with environmental change and health researchers combining. At the moment, we're somewhere away from that ideal, but we should be able to move quickly, particularly integrating satellite, remote sensing data with on-the-ground data. And we proposed, for example, that we could be monitoring some hotspots of disease and environmental change, like areas of rapid deforestation, small island states, and so on, but also opportunity sites, for example, cities, where a number of cities are embarking on very dramatic and ambitious policies to decarbonize their economies and sustain health, and areas where we're seeing reversal of deforestation and the implementation of nature-based solutions to protect the environment, and also within potential implications for human health. So we can link satellite remote sensing data with ground source data increasingly to try to monitor what's actually happening in real time or virtual real time. Increasingly—
Andy, 1 minute.
Sorry?
1 minute.
Okay, we need to integrate mitigation and adaptation in our solutions because at the moment, again, these two areas tend to work in isolation. And our most recent initiative, just starting now, is called the Pathfinder Initiative, which aims to map out pathways to a healthy zero carbon future. But very importantly, it focuses on implementation. So what we want to do is to learn the lessons of what happens when you try to implement these policies to rapidly decarbonize the economy, to move towards a planetary health economy. What are the barriers and facilitators to action? What are the impacts on the ground, both in terms of reduction in environmental footprint, but also the benefits to health? So we're about to issue a call for evidence. We hope that many people will submit case studies that would allow us to learn from what's actually happening on the ground. So in conclusion, solutions do lie within hand. We need to change the definition of prosperity to focus on the enhancement of the quality of life, delivery of improved health for all, together with respect for the integrity of natural systems. The SDG is a good framing in the near term. It's a sort of useful, but it's a first step, if you like, not sufficient. But we need to realize that health cannot be just encompassed in one SDG. It depends on the achievement of a whole range of SDGs, 1 on poverty, 2 on food, 0 hunger, 7 on energy, 11 on cities, and of course 13 on climate change, and others on biodiversity and oceans. So we need to put health, well-being at the center of our economy, but work in a very transdisciplinary environment to articulate and to evaluate the potential solutions that will help us to integrate the prospects for planetary health in the future. Thank you very much.
Thank you, Andy. That was very interesting. Now we need to move on to our next speaker, who is Professor Joyita Gupta, and she will tell us about the Global Environment Outlook, GEO6. Floor is yours.
Thank you. I think I'm going to try and build on what has been said so far and reflect a little bit on the results of the GEO6, the Global Environment Outlook, A Healthy Planet and Healthy People. I was lucky enough to be co-chair of this entire process, and it was a really exciting learning moment. But to come back to what Andy said, Andy told us we need to imagine the future, and this cover over here tries to imagine the future in terms of, you know, solar panels, windmills, people recreating. There's also a bee in the picture and so on. So it was an attempt to imagine the future. What are the key messages of this report? The key messages of this report are: a healthy planet supports healthy lives, an unhealthy planet affects human health, the drivers and pressures need to be addressed, and if you can get focus on healthy planet and healthy people, these are synergistic approaches. Just to give you a couple of numbers, though they're not very strongly emphasized in the report, our global GDP was prior to COVID-19 in the range of $85 trillion. And many people would argue that if you look at a functioning ecosystem, well, that actually provides us services that is more than twice global GDP. So that gives you an idea of how important the environment could be. When we look at the state of the current environment, it's clearly unhealthy. In terms of air pollution, we have rising urban air pollution, indoor-rural pollution, increasing temperatures, climate change, ozone-depleting substances, persistent organic pollutants. Biodiversity, as Johan already mentioned, we're in the midst of the 6th mass extinction event. And many of our fish species are overstocked. And if you look at oceans, they are suffering from coral bleaching, declining fisheries, ocean acidification, plastics in the ocean, and all kinds of marine pollution, including from sand mining, which is an up-and-coming big problem. If you look at land, we're talking about land degradation, deforestation, land use change, dumping of chemicals and wastes. And water, of course, droughts, floods, extraction of groundwater beyond recharge. And then, of course, we look at a number of cross-cutting issues. Today, we have more than 100,000 chemicals in use, but less than half have been actually researched for their impacts on nature. And we have growing mountains of waste. And at the same time, we have two out of 5 people worldwide without access to waste facilities. And so they're exposed to the impacts caused by waste dumping. If you look at resource use, we're extracting around 90 billion tons of resources every year. We also generate, coincidentally, 90 billion tons of resource-related waste. Of course, a number of us are using huge amounts of energy, and at the same time, there are 1.2 billion people without access to energy and 2.7 billion using traditional fuels, all with health impacts. And if you talk about food waste, well, globally, we are wasting more than 1/3 of our food, 55% of which is happening in the small minority of rich countries, and the rest is happening in the large majority of developing countries. And this waste amounts to not only a loss of income, but it also leads to an emission of 9% of greenhouse gas emissions. Now, if you look at what this planetary ill health means for our health, then about 25% of health impacts can be attributed to the planetary problem. In addition, disasters are killing huge numbers of people. Between 2005 to 2015, it killed 0.7 million people, affecting 1.7 billion and costing $1.4 trillion in damages. But in 2016 alone, disasters displaced 26.2 million people. So this is really quite significant. If you then sort of unpackage it, well, air pollution causes between 7 million people's deaths annually, and now it, I think, has gone up to 9 million, and huge environment welfare losses of $5 trillion per annum. Land degradation affects 3.2 billion people, loss of $4 to $20 trillion per annum. Water pollution kills 1.4 million people. Food security from the oceans affects 3.1 billion people. And if you have less fish, this was going to have a huge impact on the protein needs of this community of people. It also provides jobs to 58 to 120 million people. And if fish decreases, these livelihoods will disappear. And of course, biodiversity has a major impact, and Johan has already discussed zoonosis in some detail. We tried to look at how do we relate the health of the planet with the health of people. And what we tried to do was to try and show if we could rank these different impacts from good to irreversible in relation to planetary impacts, and in terms of human health, from low to very high. So if you look at the green to red, that's focusing on planetary impact. And if you look at the blue to black, that's looking at the human health impact. And essentially, we concluded that biodiversity was the worst affected system, air pollution and climate change the next affected system, oceans the third, fresh water the fourth, and land degradation the fifth. But when you actually look at the health impacts, this is slightly different because more people die from air pollution than, for example, biodiversity. But we also find that fresh water is killing a large number of people annually, and biodiversity also. This is done prior to COVID-19, so we didn't have the COVID figures. Then following that, oceans, and then land. But that we were stuck because land degradation impacts 3.2 billion people, but it's not that much research on the justice aspects and the psychological impacts or the health impacts of land degradation on people. But we assume then that if you take the dotted line, perhaps the impacts of land on humans could be much higher than we had thought of before. So this was just an expert, based on an expert elicitation process and expert judgment to try to bring the relationship between planetary health and human health. Now, in his presentation, Andy showed us some of the pressures, but I'm going to go to the underlying drivers of an unhealthy planet. And the underlying drivers include, and I'm going to focus on population only very briefly, because many of us think that the population growth concept is essentially linked to global inequality. And as long as inequality, both in terms of income inequality, health inequality, and gender inequality exists, we will have rising population growth in some parts of the world. In addition, we have other factors such as urbanization, but a lot of the time was also spent in looking at the role of GDP growth, because GDP growth in itself does not reflect on planetary health. In fact, GDP grows by externalizing planetary health and environmental pollution. And there's very little discussion in GDP growth about the nature of development and the quality of development. So GDP growth came up for an immense discussion as a driver of an unhealthy planet. In addition, we looked at technology, because technology can both enhance welfare, but it can also be risky. And what you find is the way the system is organized is that those who create and develop technologies, they make the profits, but the risks are externalized on society. And then, of course, climate change is now seen as a driver of all other problems. Now, we haven't discussed equity very much, so I'm going to try and discuss some papers that also came out of the GEO process. And here you see on the x-axis the privileged to the marginalized. And if you look at the contribution to drivers and pressures, the privileged have a much higher contribution to causing the problem, whereas the marginalized have a very small impact on the problem. So for example, if you look at low-income countries, their footprint is only 0.5 times their share of biocapacity. But if you look at the meat consumption in the United States, it's twice that of India and the entire continent of Africa combined. If you look at high-income consumers and how much they waste, that is as much as food production in sub-Saharan Africa. So essentially what we find is that those who are privileged are polluting much more, not simply through their consumption patterns, but also through their investment and production patterns. Their savings also contribute to these kinds of patterns. And this is a sheet from in looking at carbon inequality, which sort of illustrates this to some extent. And what you find is that the richest 10%, that's in gray and black, they basically are responsible for 52% of the cumulative emissions of greenhouse gases between 1990 and 2015. If you look at the poorest 50% of the global population, cumulatively, they have been responsible for only 7%. So how are we going to deal with the inequality aspects of this issue? Now, if you look at the vulnerability to risks and impacts, then you see that the story is very different. It's the marginalized who have much higher existential impacts than the privileged. Now, of course, in dollar terms, it is possible that the privileged suffer more because they have much more money in their investments and therefore they will lose more. But it is the marginalized that lose a much higher percent of their income or livelihoods. They're slipping back into poverty, as COVID-19 has just recently shown. And so there is a really big problem over here. about the mismatch between those who cause the problem and those who are affected by the problem. And this also affects the way in which we try to solve the problem. So it's getting late, but it's not too late. So let me give you some of the good news first, because I was also told this afternoon that we must present optimistic stories. Well, the treaties are partly successful. Protected areas are going up. POPs and ODS are decreasing. We are keeping our seeds quite safe in this global seed vault, but we haven't recognized that the bulk of global seeds have been actually protected by women farmers whose job it is to collect and manage seeds. In addition, in Germany and China, we are seeing that the renewables are going up without causing GDP to go down. In Norway, we are seeing that electric cars are on the rise. Nigeria and China are experimenting with green bonds. Many developing countries, including Bangladesh and Eritrea, are regulating plastics. Countries like Chile are using territorial use rights for fishing. Canada is using transferable quotas for fishing. And we know that if you invest $1 in WASH, you will get a $4.3 return in improved well-being and health. WASH, for those of you who don't know, refers to access to water and sanitation and hygiene services. And if you invest in 2 degrees centigrade, that would probably cost the global community $22 trillion, but the returns will be at $54 trillion. If you look at what industry is doing well, there's a lot of innovation happening. The solar industry can provide twice as many jobs as the coal industry in the United States. Recycled waste is a booming market. Digital technology and smart meters can help avoid electricity infrastructure. We can innovate in the supply chain. We can dematerialize, decarbonize, and detoxify within a circular economy. And of course, there are huge numbers of bottom-up initiatives. For example, a plastic waste footprint calculator, Youth Ki Awaaz, or storytelling, Swapaholic, or swapping clothes, and so on. There are hundreds of these bottom-up innovations. But does it all add up to change? And our report concludes that despite each global environment outlook so far, we have not been able to make the kind of impact or dent in the politics of decision-making and in solving this problem. And why is this the case? Since we didn't discuss it so far, I'll just give you one little example. If you really want to phase out fossil fuels, that basically means you have to strand assets worth between 12 to $200 trillion, depending on how you calculate. Now, I told you earlier, the global GDP is around $85 trillion pre-COVID. So the question is, are the super rich really willing to not use their fossil fuels? And don't forget that 80% of the remaining fossil fuels are in the developing countries. If we want to now stop using fossil fuels, the developing countries de facto are the ones that have to make the sacrifice. And that creates another equity problem that's happening. And to add insult to injury, most developed countries, like the Netherlands, like the UK, like Germany and the United States, they are actually subsidizing the export of fossil fuel technology and knowledge to the global south because they want to protect their own industries. And they do this often under the title of, let's help developing countries develop. But actually what is happening in this process is we are transferring stranded assets to the global south. So in many ways, there are huge political contradictions that stand in the way of our understanding of how to address environment and health issues. Thank you.
So thank you so much, Julieta, for the very nice presentation. Thanks a lot. And we now pass the floor to Mrs. Marian van Merlo. Marian, thanks a lot for being here. We know that we are in a unique context in Europe as regarding to the solution, so the floor is yours.
Thank you so much, Joseph. I will also first try to see if you can see my slides moving. Is this the case? Yes, great. Okay, so yes, I will take you into a bit of a different part of it. I think it actually connects quite well to the previous speakers. I'm quite honored to be there in their presence, because they are really sort of shaping the conditions on which we are building with our research project, our research program. First of all, let me introduce you myself. So I'm Jan van Mierlo. I'm a policy officer at the European Commission at DG Research and Innovation. And I actually work in a directorate which is called Healthy Planet. So, you know, talking about planetary health seems very appropriate. And within that, I'm working on mostly environmental observations as part of Earth observation. Then, as said, I will highlight a slightly different perspective. I will take the perspective of the Commission and then zeroing into, in the end, Horizon Europe, which will be the upcoming research and innovation program. So in 2019, we got a new Commission with Mrs. von der Leyen. And the focus became on the 6 priorities, as you see here. I won't list them all, you can see them, but the most important thing for this particular topic is actually the European Green Deal here. But also Europe Fit for the Digital Age, as you see later on, it's very much interconnected with what we want to do. And the same goes for all the other priorities. So where they are set as 6 different priorities, in fact, they are all interlinked in one way or the other. For now, I will take you into the world of the European Green Deal. Climate change and environmental degradation are existential threat to Europe and the world. I can tell this to you again, but I think my predecessors were quite convincing in making sure that you know this. And to overcome these challenges, Europe needs a new growth strategy that will transform the Union into modern and research efficient and competitive economy, where there are no net emissions of greenhouse gases by 2050, where economic growth is decoupled from resource use, and no person and no place is left behind. And especially after the talk of Yosita just now, I think you see that this is extremely important. And the European Green Deal is our plan to actually make the EU economy sustainable. So both by turning climate and environmental challenges into opportunities, but also making sure that this transition is just and inclusive for all. So what is this Green Deal? It basically consists of 8 different themes, which you can see here. Oh, apologies, I go a bit too quickly, which you can see here in, let's say, the bit darker greenish elements, including the climate ambition, including energy, including cleaner circular economy, and of course preserving and restoring ecosystems and biodiversity. Basically the whole compound, or all the components in the end contributing to the objectives of the European Green Deal are in here, but also making sure that this transition is of course financed and that nobody is left behind. So to kick this off, and it's already closed, it had a deadline of the 26th of January recently. We actually set off, still within the context of the Horizon 2020 program, a European Green Deal call. This was actually a 1 billion investment to boost the green and digital transition. We had this before the start of Horizon Europe to sort of kickstart the European Green Deal. We found that there was a pressing need to confront the climate crisis and provide greater protection for the continent's unique environment and biodiversity, but also aiding Europe's recovery in the wake of the COVID-19 crisis, contributing directly to the EU's recovery plan for Europe. And then within this European Green Deal call, we were actually covering the areas I just showed you in the darker green within the Green Deal, but also 2 horizontal areas. And we had a massive response. We had in the end 1,550 applications received. So we were quite happy with this response. We see that this is in the center of what people are finding important and where research should focus on. On the other hand, this also means that the rate for success is unfortunately for some of the topics quite low, but okay, this is part of the game for us for now. The most important thing is that we know that this is indeed what people want to work on. I want to take you also into another call which has already closed, But just to show to you that we are sort of approaching this, and I think this is also what Annie remarked, you shouldn't think in specific policy silos, but you should really take it as sort of a combined domain, if you want. And one of the things we've done that with, and the deadline for this prize was only last 16th of February, so only a week ago, is actually this EIC Horizon Prize on Early Warning for Epidemics. This was one of the 6 prizes which was launched under the EIC pilot for the work program in 2017-2018. And this EIC pilot has now, within Horizon Europe, will actually become a whole pillar, so a European Innovation Council. And with this EIC Horizon prizes, we are working what they call an inducement prize. That basically means that if you start this topic and sort of throw it into the world and say, please go working on this, that you will spark innovation on a particular topic throughout the world. And in the case of Earth observation and health, we had this EIC Horizon Prize for Early Warning for Epidemics for 5 million euros. This prize is awarded after. So that basically means that instead of filling in a call, making a consortium, signing a grant agreement, we ask you to send us the solution. And on the basis of solution, you can win the prize or not. And thus, as said before, hoping to spark innovation across the globe. This specific challenge was actually to look for a scalable, reliable, and cost-effective early warning system prototype to forecast and monitor vector-borne diseases. So even though it reads epidemics, and even though that seems very timely now, we are talking about vector-borne diseases here, so not the zoonosis part. And the whole idea here is that you, in the end, have also the effective management of the big data in the EO domain. So we are looking, and I think again, I'm very much connecting to what Andy said before. We are looking at combining the elements of big data, of Earth observation, of I don't know, meteorology, biodiversity information, how much of the population of mosquitoes are infected by malaria. What can you say on the basis of the weather conditions upcoming? How can you put that in a big data system? These are the kind of elements which this prize was explicitly looking for. So in terms of trying to mix those different elements together and to look at it as a holistic approach, this is really what these prizes are intending to do. So these expected results include a demonstration of the prototype to make sure they go beyond, let's say, the theoretical research and have some certainty that they will actually work. So this was launched already in April 2018, just to show you that we are really for this kind of prizes, and this is not the only one, but really looking at a longer period for people to be actually able to develop this prize within the time given to develop the solution, I mean. But then we go into current situation, almost current situation. Horizon Europe is about to start. It's almost 100 billion for the period of 7 years, so 2021 till 2027. And it's set up in 3 different pillars. So you have the excellent science, you have the global challenges, and European industrial competitiveness, and you have the innovative Europe. Within those 3 pillars, I will mostly focus on pillar 2 for this presentation. But for now, I will first take you into 2 separate things. And one is the so-called missions. I'm sure that you've heard about this already. This is really, again, following the whole idea of not having only specific projects, which is also really relevant, but also having a concerted action. And the mission is, as said here as well, a portfolio of actions across discipline intended to achieve a bold and inspirational measurable goal within a set time frame. So these dedicated sections in the Horizon Europe work program are foreseen for the missions. So where the mission related topics will be published. So if you look into the Horizon Europe work program, there will be a dedicated section on this as we foresee now. I should say that we are in the final phases of drafting, so everything I'm telling you now is still with the disclaimer that it's not completely finalized, but anywhere in spring is for now the idea that we would have this published April most likely. So there are 5 missions. You see them here listed. Looking at what I've heard today, just looking at the words planetary and health, basically all of these 5 missions are very appropriate within that context. They are targeting different aspects. Conquering cancer is about health, but a specific part of health, but then climate resilient Europe. I've heard, I think again, Andy said before, but it might be Johan, about mitigation and adaptation not being connected well enough. Well, actually, this climate mission is intending to look at both sides. And then we also have mission starfish, which is about healthy oceans. We're looking at climate neutral cities and at soil, which is of course very much connected to the agricultural domain. Next to missions, another novelty, or maybe it says here new approach, is actually to the European partnerships. Over the last couple of framework programs for research and innovations, we have had different sorts of partnerships. We now take a new approach to them, sort of revisiting the whole partnership landscape and having the key features of a simple architecture and toolbox, having a coherent life cycle approach and a strategic orientations. And really, in the end, putting them only in 3 categories. So the co-programmed one, the co-funded ones, and the institutionalized ones. Also for this, even though already in 2021, so under the first work program of Horizon Europe, some of these partnerships will start, it's still also work in progress. So for the co-programmed and co-funded partnerships, the only thing I can say that if you are aware of how the ERANET used to work, this is the most similar to what this will be, but it's not exactly the same. So the co-programmed ERANETs will be more or less comparable to the co-programmed partnerships as is for the co-funded. The institutionalized partnerships are the ones that before were the articles 185, 187 partnerships. So the joint technology initiatives, for instance. And then this new approach to partnerships, it's really intended to bring the European Commission and private and or public partners together. Also here, it's depending a bit on which kind of partnership you have. It's addressing some of Europe's most challenging, most pressing challenges to really concerted action. So it's going again here, like the missions, beyond the idea of separate goals. And they're a key implementation tool of Horizon Europe. I will just, because I know that you might be interested in joining this if you can, I would just like to point you out to the link which is on the bottom. If you go there, you will be able to find information on the partnerships and also contact persons. For some of them, like the co-funded, it will be mostly the European Commission with the member states. So it might be good to go to the contact of your member state or otherwise directly to the contact people listed here. I see, Jana, that you don't give me much time, but I won't need much time anymore. I just wanted to show you that these are the clusters we have right now, even though the areas of interventions are a bit outdated. We are looking at destinations now. This is the one I will take you slightly into, but please also take a look at health and climate. And then just as a last follow-up, the Horizon Europe intervention logic and priorities are defined in the strategic plan and they go for 4 years. So even though the first work program will only take 2 years, the complete setup is already for 4 years to make sure we look forward and we have a plan a program that works together. And within the work program, we have specific, let's say, coherent packages of goals, which are called destinations. And this is different than it was in Horizon 2020, when you are answering to a call, you're not only supposed to look at what is necessary for the call, but also what is necessary for the destination as something to reply to as a condition of the call. There are complementarities with other clusters throughout the program. So even though it is set up in a cluster way, it's not set up as a standalone. And just to briefly show you that this is indeed the case, I will like to show very short, so please allow me this, the topic of environmental observation, which is the part I'm working on. It's cross-cutting over many destinations, but whenever the environmental observation, let's say as the tool as it is in the heart of it, then we're looking at the part of environmental observations, but it's overall contributing to the Green Deal objectives. And it's really of great value in assessing the planet. So that's why it's so important. And then we're looking as sort of the larger objective to ensure better accessible, interoperable and deployable information. Here as well, integration of many different sources of information is important, very important in the context of planetary health. And just as a last one, because you can see this slide later on, as the last one, I wanted to mention that one of the domains we will try to tackle within this environmental observation part is the One Health. So not only the human health, not only the animal health, but the whole planetary health. And that is it. With that, I would like to thank you.
Thank you, Marianne. It's really nice to hear and see that there will be funding for the planetary health topics from the EU. Next, we will move on to the panel discussion. I will still encourage audience to send questions to the Q&A. And to begin with, we are privileged to get a comment on today's topic from member of the European Parliament, Sirpa Pietikäinen. She also attended the Helsinki conference in 2019, and she has been the member of the European Parliament since 2008. In the Parliament, she is a member of the Economic and Monetary Affairs Committee and in the Women's Rights and Gender Equality Committee, as well as a substitute in the Environment and Public Health Committee. So please, Sirpa, the floor is yours.
Thank you so much. And first of all, let me thank the organizers for this extremely important initiative to bring this planetary health, one planet, one health aspect on research, but also on political domain. And let me draw some political level conclusions. You are the experts as panelists and science makers of detail. So I won't be quoting on those topics, even though I've been trying to follow up what are the actual linkage points that we could hear very well earlier on this geo research, be it air quality or be it biodiversity or be it chemicalization, microplastics, or that matter up to the human health. My first point would be that we would need to have an integrative and system thinking that takes into account the complexity. Sounds very difficult, and we as politicians are not very used to that. Let me just pick up an example. We just had a very heated debate yesterday about whether to follow the WHO's recommendations about the ambient air quality when we go forward in the Parliament's position. And those were those people who were speaking for the health, those who were talking about the environmental impacts, and those who were talking about what is the impact for car producers. And then the another aspect was the social implication. What about those people driving with old diesel cars? Are we trying to ban them the possibility to drive and have an access to our urban areas? If you think silos and you speak silos, and you can't raise your awareness on the bigger picture. And then if this is the approach, it's a bit as big paradigm change in politics as it was from imagining that the world is flat up to the picture that it is actually round and it is a ball. And why I want to raise this is that if you imagine that the world is flat, you can't create the concept of sailing around it. So first you have to get the bigger picture right. And this needs this kind of a system thinking. And we are used actually to complex system thinking in our everyday lives, and somehow we just miss it in politics. And I usually use this fish soup example. We all know that the fish soup is different and better, and this is the synergy, than just the sum of its ingredients. But still in the politics, we are debating how to prioritize. Should we cook the potatoes or maybe the carrots and or the soup, and then we wonder why it doesn't taste like a fish soup. So what's wrong? Next, we probably need to prioritize the onions or whatever, and it still doesn't taste like fish soup. And this way of thinking is very deep, this silo, sectorized and linear thinking. And being quite some time in politics and discussed with quite a number of you and heard even more often, this kind of a connection understanding at the point of understanding what it means that the growth of the challenge is exponential is very hard to convey the message in politics if these words are used. And sometimes if you just say that we are speeding up and the wall is approaching and we are up to having 160 kilometers per hour and after 10 seconds it's 200, and we would need to decide when to take the foot over from the pedal and start braking. To have some ability to do some with the wheel. And then when it comes to this kind of posing the right question.
Half a minute, Mrs. Pietikainen.
Yes, and I'm concluding.
Thank you.
To come to this conclusion, what is needed is posing the right question and sort of ticking the box. It needs to solve all of the issues. And if it only solves one and it has a spillover effect, that is not going to be the right one. And last comment is about who draws this bigger picture. And there I will turn to you and your organizations. It would need to be the science turned in everyday language. And it would need to be science-based and backcastive approach in politics with outside measurement. And I proposed to the Commission that we would have an independent science panel to do that. Not a silo like the IPCC, but including all the elements of human sustainability, health, and the planetary environmental sustainability. Otherwise, we can't deal with these separate issues. I hope that this was of some help, and hopefully you can provide the materials up to us in the European Parliament to act upon and change our patterns of behavior. Thank you.
Thank you so much, Mrs. Pietikainen. I think it's having the opportunity to finish with a caveat on the political level, and having someone like you with your role, reminding the importance of the systems thinking and the integrative approach in politics. I think it's a reason for hope. Thank you so much. So we can now invite the other speakers and panel to just connect the cameras and join us for the discussion. We still have a few minutes for the discussion, and I will perhaps start with a question of one of our participants that it can be addressed to two of our speakers, Professor Franking and Professor Andy Haynes. And the reflection of the participant is that you have made a strong case that we need to be integrative and we need to be transdisciplinary. But probably the main bulk of the funding programs that we have everywhere, but more specifically in the European Union, will still put the emphasis on the specific topics. And then, so the difficulty and the challenge for the health people to jump into issues like biodiversity or oceans quality or things like that, it's a tremendous challenge. So what would be your recommendations, Howard and Andy, on this regard?
Andy, would you like to begin or shall I?
You go first, Howie. Yeah.
Well, I think it's an excellent question, and at least three solutions come to mind. One is at the educational level. We should be training our young researchers to think across disciplines, and that will increase both the capacity in the research workforce for doing this kind of work and the demand for integrative funding. The second is to think about innovative funding arrangements so that complex institutions, which are broken into departments of necessity, can work together to move funds in integrative ways, co-funding important initiatives. And the third is to define research funding programs not according to disciplines, but according to problems. So if the problem, for example, is the relationship between climate change and health, don't define it as an Earth system problem or a biomedical problem or an epidemiologic problem, but define it according to the impacts of climate change on health. Complex problems are intrinsically transdisciplinary, and that means that the research responses will have to be transdisciplinary. So training researchers, funding in innovative ways that are cooperative, and defining problems rather than defining disciplines.
Yeah, well, I can just really endorse a lot of what Howie said. I'm afraid I can't turn on my video camera. I've been turned off by the host.
Oh, really?
But let me just say a few words. So I think one of the issues, and I was very heartened by what Mrs. Pietikäinen said, because I think we also need to see a demand from policymakers for this kind of integrated evidence. And it has to be very strongly co-designed with those people who are going to use the knowledge. And I think that's probably quite a major error that we've tended to make in the health community and more broadly in the scientific community. We generate evidence, then we go to policymakers or decision makers and say, we've got some wonderful evidence here, why don't you act on it? And of course, they often don't. And that's because we don't really listen to what their demands are and what kind of decisions they actually have to make. So I would argue for a much closer partnership between research community and policymakers, decision makers more generally, not just at the national level, but the subnational level as well. And that means we actually need to work with them to understand what the challenges they are, what decisions they're making, what are the implementation challenges to putting transformative change into practice, and actually to embed our research into the activities that are already going on. That takes time. You can't do that overnight. You have to establish partnerships over time. We've been working with a number of cities around the world funded by the Wellcome Trust. And, you know, after 3 or 4 years, I would say we're just beginning to understand some of the complexities of the systems within urban centers for decision-making and for implementation. And we're building up the relationships with some of those decision makers. So it takes time. It takes a different approach to research commissioning. It takes much closer engagement of policymakers and a commitment to co-design. And I think that has to be linked to the kind of research funding that we give out. Thank you.
Thank you. I was wondering if Marian, you had some comment on this.
No, yeah, very, very much. Thank you so much. No, indeed, I'm completely agreeing with this. And what we try to do more so in drafting Horizon Europe than we have been in Horizon 2020 is actually do this co-design approach. We have had the Research and Innovation Days last September and the September 2019, where actually specifically for the missions, but also for the other parts of the program, this was a particular objective of us. And I hope I've been showing with some kind of convincing aspects that this is also part of the program right now. We really say to future applicants, don't only look at the topic which is related in name to what you are used to doing, but please look across the program, because we have been trying so hard to make even more interlinkages than there were before. And of course, it is still set up in clusters. I'm very well aware of this, and this is also something that has to change with time, but more so than before, this is really what we've been trying to do with Horizon Europe. So yeah, let's see if that works out that way. But we are quite let's say this approach is new and exciting for us in the sort of broad way in which we set this out to do for Horizon Europe.
Thank you. Let's hope that that work continues also in the future between researchers and funders. There is a question for Joita from the audience. Do you think the principal actors behind man-made industrial air pollution, like motor manufacturers, should support the health costs or the financial burden of the people and families that are affected?
Actually, yes, I do. And there has been a court case. I don't know about the health cost there, but there has been a court case in the United Kingdom which attributes a child's death to air pollution in London. And so that's one of the first cases where you actually see air pollution being linked to human health issues. I've also seen that we have something called the extended producer responsibility concept in the European Union, which basically means that if you sell a product to somebody, then that somebody uses it, and then after that dumps it, then what happens to that product? So maybe that product is then dumped by the European Union on Africa, or maybe it is just incinerated, maybe it causes other health problems. And there, extended producer responsibility comes to hold the producer responsible for the impact caused by that dumping process once the consumer has done with it. I absolutely think that we have to think of clever ways in which we hold actors responsible for the impacts that they cause on others. And in the legal system, there is a no harm principle, which clearly states that if you are, for example, there's a very important court case between between the US and Canada, the Trail Smelter case, which was pollution from one country was going into the other country, and the court held that the pollution had to stop and compensation had to be paid. So, in that sense, there is enough precedent to move this notion further. The problem is almost everything we do is causing problems. And so the question is, how do we deal with the pollution impacts of activities that are not yet forbidden by the law? And there is a big role for us to play in trying to further develop this responsibility towards others.
Thank you very much, Joita. One question for Professor Rockström. Johan, you have been championing the efforts to translate the scientific evidence about the tipping points to the full society. So the politicians in big forums, in the mass media, and producing very, very relevant research. But very frequently, the experience of these tipping points are physically perceived at the more local level. And then we have had this unexpected pandemic, which is really a kind of a tipping point. So how this experience of the pandemic has impacted your views on the science of the tipping points and the translation that you are leading?
Well, I think that's an excellent question, and I can answer very simply to say that it's been a tremendous help, and I would quite strongly argue that one of the really important lessons from this global health crisis is that we learn that we're all interconnected across scales, that what happens in one corner of the planet can, to put it a bit literally, go viral across the entire economy and shut down the economy and have impacts in a very abrupt and very rapid way across the whole world. And it's exactly the same way with the tipping points in the Earth system. What happens in another part of the planet, be it the West Antarctic ice shelves or rainforest or permafrost or temperate forest, if we push them too far, they cross a tipping point, and they will also be sending in voices that impacts livelihoods, jobs, economies across the whole world. It won't happen with the same pace, but it will be more serious because it will, with a very high likelihood, be irreversible. So that's what I would see is the difference. I mean, so there's a similarity in terms of they're both commons. What happens health-wise in one part of the world is a commons hitting health, and what happens environmentally is a commons hitting planetary health. The difference is that the impact may, instead of happen over weeks, like the pandemic, happen over decades, as with climate change. Now, one of the challenges for us is to communicate to people to understand that there's no difference there either. In terms of precaution and in terms of morality or ethics or justice or as humans, we need to feel responsible also for the intergenerational impacts of not allowing irreversible changes to occur. I find it very nervous to see the most conservative projections showing that if we pass 2 degrees Celsius, we will ultimately hand over a planet with several meters sea level rise, because that's the landing at 2 degrees Celsius warming. Of course, it won't happen over 10 or 20 or 30 years. It will take hundreds of years, but it's unstoppable. So, I mean, there are a lot of lessons, even though there are differences, but I think there is fundamentally a learning process that we have started to internalize from the pandemic.
Thank you so much. Jana?
Yes, did I see Silva raising your hand? Did you have a comment?
You are muted, Silva.
Yes, just very quickly, if I may. I would suggest that in this your research group, you would have some lawyers. And I just come back what Troyetta said about this integrative approach. So we shouldn't talk about the environmental responsibility, but it is overall responsibility. You shouldn't talk about economic risks and the costs of non-action, but you should only talk about the cost of non-action and financial risks and integrate the environment and health and social there. You shouldn't talk about what is the company liability differently about other producer points or economic liabilities. If the product breaks down, it is a liability all in all for people and planet. And just it would be very interesting to see how EU legislation would look like if this integrative approach would have been taken into account. Sorry for taking your time.
Oh, thank you so much. I think it's just 2 minutes now left to finish the session, and it's perhaps the time to finish with some final remarks. Jana, do you want to start or should I? This is always... We cannot hear you now. Yeah.
Okay, yes, we didn't plan this part, but I think we have seen a great set of presentations today, and I would like to thank all the presenters. And also there were more questions that we didn't have time to go through today, but hopefully these will be answered at some point. And then I could give the final words to you, Josep.
Well, thank you so much. Has been a tremendous pleasure. We have been for months designing the program and the session, contacting the speakers, and having you all here contributing and inspiring us is such a big pleasure. So we thank you so much for the effort you have done in your agendas and in your life to share with us. It's very difficult to conclude such a rich session like the one we have had today. It's plenty of comments from our participants in the chat. I will probably finish, if you allow me, with one of the challenges that Professor Andy Haynes was reminding us the challenge of imagination and how rethink the society, and the concern of one of our participants saying, well, it's not difficult to imagine a society that through renewable energies and innovation forget the lesson and again ends in a spiral of consumption and inequity in the world. And this is fundamentally one of the big challenges, how we take advantage of this big unprecedented challenge to make a better world, especially for the ones that are today the more vulnerable and the less favored in our society. And I think that with this, it's time to finish the session, to wish you the best, take care, and let's keep working together. And to all participants, remember that the session recording will be available and that you will be sent reminders. Please, those that are interested, don't forget to register for the next sessions, and we will do our best to keep in contact with all you regarding to your questions in the chat. Thanks again to our speakers, and have a nice day.